What makes this a really full room is every one of you is connected to other people, connected to other networks, is repeating this story, and they're repeating that story. And so, but in creating this movement, I have to recognize that there's only going to be so many that are in this champions and early adopters. So the champions, I talked a few slides back about 2 other ladies that helped me write that purpose statement. There's maybe about 5 others that I would consider that are the champions, and Pat would be one of them, and Brandy would be one of them. There's only so many people that work at that level, but you also only want a few people working at that level. Because as soon as, if there were 50 people as champions and early adopters, you'd be moving so slow. So I really consider that a success. Even if there's not a lot of people in the room, it's about who those people know and how that story gets created. Because what you want to do is this field right here, some of which are down here, these are the ones that don't matter. I will never try to change their mind because I never will, and I could die trying. But there's a whole bunch in here that you want them to find themselves in your story a bit to create some spectators that create a following. And one of the people that, again, back to that bigger audience, we have, her name is Su Ling Go, who does Health Matters on Global TV. So we have that media piece. But she knows that if she comes to a room, the conversation she has, the very first thing we say is, this isn't for public information. And she respects that, because we're not trying to create a sensation here, we're trying to create a movement and inspire change. And so we want to create a following around that so that it's the tweeting, and I mean, Pat's a master at the social media piece, but that's what we're trying to do, is create the swirl and create the energy. But some of it is teasing the audience. I bet you in the last year, I have spoken to 100 highly influential people. Out of that 100, I would say 5 of them that have got on board. But that's a win, because they are really smart, they understand the issue, they're connected to government, they're connected to health, they can really make change happen. I didn't need 100 people, I needed 5 really committed, effective people.